Knock, knock.
Hello.
Hi, I'm Lily. I'm going to be your student nurse for today. Can I have your name and your date of birth, please?
Barry Smith, June 4th, 1992.
Okay, thank you. So the doctor wanted me to discuss the results of your genetic testing with you. Is that okay?
Yeah.
Okay, so as you know, Duchenne's muscular dystrophy is a red flag. It was found in your pedigree because your husband, his two brothers, died from the disorder, and all of his sisters and mother and grandmother are carriers. So I know that you guys had some concerns about your offspring having DMD. So what I'm going to do is explain how it is passed. So as you know, males have an XY chromosome and females have XX. So DMD is passed along the X chromosome, and it's actually an X-linked recessive pattern. So this means that in order for a male to have the disorder, it has to be passed from his mother, who is a carrier. So his mother was a carrier, but he does not have the disorder, which means he is never going to have it. And males can also not be carriers, so there's no chance of him passing that on to his future children. And with you, we don't have any signs of DMD on your side of the family, which means you're not a carrier. So essentially, we can say that you have pretty much no chance of having a child with DMD, which is great news. But would you like me to go through and tell you some of the symptoms of DMD?
Yes, please.
Okay, so from a young age, the symptoms become apparent. Usually the infant is a late walker, and their calves look enlarged, and you would think that it was large muscles, but it's actually scar tissue. And they tend to be really unbalanced when they walk, and they kind of walk with their stomach sticking out and their shoulders back, and they also walk on the heels and their toes of their feet instead of like normal walking. So because of all that, they tend to fall a lot. By the time they're age 7 to 12, they need a wheelchair. And a lot of times they like electric wheelchairs because it gives them more independence. So around the same time when they need a wheelchair, their respiratory and cardiac function starts to decrease, which is usually the reason why they die. So the heart lining begins to weaken, and specifically the myocardium, which is one of the layers of the heart. So typically the boys die between ages 17 to 20, and sometimes in about 1/3 of these boys they have mental retardation, which is usually a mild form. So there's many issues with DMD, and a lot of the times it's treated as the symptoms progress. So like with the respiratory issues, if they were to get an infection, we would treat the infection. But one thing that we like to give our males with DMD is corticosteroids. So essentially, corticosteroids provide relief to inflamed areas. In this case, it would be the heart. Although there are many positive side effects to corticosteroids, the patient is given certain guidelines that he is supposed to follow. So there's a very long list of medications that you cannot have when you're on corticosteroids. So the doctor would go through and make sure there wasn't any interactions that were happening there. And also, prednisone, you need to be on a low sodium diet and have no weight gain. So prednisone in particular with DMD is believed to help stabilize and improve muscular function. It is also believed to help patients ambulate, which would just be to get up and move.
Okay.
So do you have any questions for me, Ms. Smith?
What is the survival rate on the condition?
Okay, so usually the boys die between age 17 to 20 is the median, but by age 25 there is only a 13% survival rate.
Okay. And I did a Google search on my own of prednisone, I believe it's pronounced. Yeah. I've seen some horror stories. What can you tell me about that?
Okay, yeah. So prednisone, as with any medication, it has a therapeutic effect, which is what it's supposed to do, and also has side effects, which are things that we know are going to happen, but we can't prevent them. So the complications from these interactions can be deadly, like if they're mixed with another medication, so you need to really keep a close eye on that. So some of the symptoms, the less common ones would be decreased or blurred vision, frequent urination, and increased thirst. And then the rare side effects would be blindness, burning, numbness, or tingling at or near place of injection. So prednisone can be given orally or by injection. So that would happen if they were to get an injection. Confusion, excitement, a false sense of well-being, hallucinations, mental depression, mistaken feelings of self-importance or being mistreated, mood swings, redness, swelling, or another allergy at the place of injection, restlessness, and skin rash or hives. And so all these side effects get worse the longer you take a medication. So if you were on a medication for like 5 years or so, you would have worse symptoms than if you were to take it like at the beginning.
Okay.
Okay, do you have any more questions for me, Ms. Smith?
I think that's everything. Thank you.
Okay, thank you for your time.